Hi and welcome back to another video of Medic Notes. This video is on multiple myeloma. Multiple myeloma is a neoplastic proliferation of plasma cells resulting in gradual replacement of the bone marrow with cancer cells. It causes pancytopenia, bone symptoms, hypercalcemia, and renal impairment. Common in 65 to 70 age, male to female ratio of 3:2. For clinical features, bone marrow replacement with proliferating plasma cells causes pancytopenia, which includes anemia or bleeding secondary to thrombocytopenia. Lytic bone lesions, presenting with bone pain, risk of pathological fractures, hypercalcemia, or spinal cord compression. Soft tissue masses. Overproduction of antibodies causes renal impairment, hyperviscosity, and amyloidosis. Impaired humoral immunity, causes susceptible to infection with encapsulated organisms. Asymptomatic patients may be identified through screening. Its etiology is thought to be a combination of genetic factors, environmental exposure to chemicals in agriculture, and radiation exposure. For investigation, full blood count may be normal or pancytopenia. ESR virtually always very high. Urea and electrolytes show renal failure. Calcium is often raised. Uric acid is normal or raised. 24-hour urine collection for Bence-Jones protein or gamma light chains. Plasma electrophoresis for paraprotein band. Beta-2 macroglobulin and CRP are prognostic mediators. Skeletal X-rays are targeted MRI, in cases of osteoporosis, crush fractures, and osteolytic lesions. Pepper pot skull is a characteristic finding. Classification of multiple myeloma is based on the monoclonal product. 55% IgG, 25% IgA, and 20% light chain disease. For staging, stage 1 involves all of following. HB more than 10. Calcium less than 12. Radiograph showing normal bones or solitary plasmacytoma. Low M protein values. IgG less than 5, IgA less than 3, urine less than 4 grams in 24 hours. Stage 3 involves any one of the following. HB less than 8.5. Calcium more than 12. Radiograph showing advanced lytic bone disease. Or high M protein values. Stage 2 is anything in between. These three stages are subclassified according to renal function, A for normal creatinine and B more elevated creatinine. Mean survival, 60 months for stage 1, 42 months for stage 2, and 23 months for stage 3. Diagnosis can be made if there is monoclonal band on plasma electrophoresis, Bence-Jones protein in urine, plasma cells on BM biopsy, and osteolytic bone lesions. Treatment of multiple myeloma. Myeloablative therapy, which is high-dose radiotherapy and chemotherapy, with autotransplantation of BM stem cells. Plasmapheresis for renal failure. Hydration and bisphosphonates for hypercalcemia. Radiotherapy for bone pain, as myeloma is highly radiosensitive. And vaccinate against encapsulated organism. That's all for this video. Thank you.